Again, this is not your mama's menopause, and I say this is a fantastic time to be a menopausal female because so much research and resources are being allocated to women's health. So I'm really excited to share some information about what has worked for me personally as a registered dietitian and also a woman in menopause, and also what has been working fantastically for my clients. So I'm going to share my screen. If you have any questions, please feel free to type in the chat and I will try to get to as many questions as possible. And where is my PowerPoint? Right here. All right. Okay, so I'm pretty sure you guys can see this. I am going to start it from here. Let me know if you cannot see this. Hopefully you are, but we're going to dive right in. And I want to tell you a story about a client of mine. Her name is Lisa. So Lisa was my client. She was about 45 years old, so it's been a little bit since I've been seeing her, and I was just ongoing as a nutrition client. And so she is a married woman with two children. She is a business professional. She's very busy in her career and very proud that she can juggle everything. And so around the age of 45, we had an appointment and she said, things are starting to change in my body and I'm gaining weight in my stomach. And I've never had weight here in my midsection. And now I'm getting, this midsection weight gain. She wasn't feeling good about herself. Her body composition was changing. And so we went through her diet. For me, as a registered dietitian, and I do have a PhD in nutrition, I have been trained to recommend nutrition interventions based on how much a person eats and how much they exercise. So we went through everything and I gave her some guidelines. She tried it out. She came back. I'm still gaining weight. I'm tired all the time. And she started to tell me some of these symptoms that she was having. So restless nights and hot flashes. Hot flashes came and went, weren't all the time, but she was very restless at night. She had the weight gain. And she started noticing that she had like a brain fog where she would forget words or she was having a hard time multitasking. And this was something that she really prided herself on. She also started noticing her hair was thinning and she was having a lot of joint pains. And she was worried maybe she was developing arthritis. And she's like, and I have a really weird body odor when I'm sweating, when I'm working out. And so we kind of reassessed what she was eating. And in the back of my mind, I was like, well, maybe she's not being so truthful with what she's eating or what she's doing. So we changed things up a bit. Nothing changed with her body composition. So I was like, well, why don't you go to the doctor and see what your doctor says about some of these things that you're feeling? She went to two different doctors. The first one said, you're juggling a lot. Women your age often feel overwhelmed. So this doctor recommended cut back a little bit, cut back on your stress. And they also said it's normal to feel out of sorts, probably just a little anxiety. Not really happy with that question. She went to her gynecologist. Gynecologist said, you know what, let's try some antidepressants. That will make you feel better. And she was also told, there's no way it's menopause, you're too young. She was only 45 at the time. And she was like, okay, good, I'm not menopausal. God forbid, I don't want to be in menopause. And so I gave her some more guidance, but nothing was really changing. And she kind of felt like things were spiraling. So fast forward to about the time that I'm 45, 46. So in the past 2 or 3 years, I started noticing very similar symptoms that Lisa had told me previously, as well as other women that have come to see me for nutrition guidance. I was starting to experience the restless nights and the hot flashes, and I was forgetting words. I'm like, what's that thing that you flip the pancakes? What is that called? Oh, spatula. But this was happening all the time to me. My hair was changing. I was having brain fog. My hips were killing me. My left hip was almost to the point where it was unbearable. I was getting restless leg. My lips would burn all of the time, especially right before my cycles. And I was like, what is going on? And this was about the time where we were starting to learn a little bit more about perimenopause and menopause. And I realized, much like a lot of my female clients before I started experiencing, we were all going through symptoms of perimenopause and we didn't know it. Right now, though, we know with the right combination of nutrition and lifestyle adjustments and education, women can take control of their health and actually thrive through menopause, where this was really a topic that was kind of taboo. When I asked my aunts about menopause, they were like, oh, we didn't really talk about it back then. We just kind of suffered through it. Um, and the good news is we don't have to suffer through it. And right now, there's a lot of conversation and there's a lot of different factors that come into play that we can add to our lifestyle to help us. And I'm going to talk to you specifically about strategies that you can implement today. So you're going to walk away with strategies that you can start right now. But before I give you that information, I want to talk to you a little bit about the role of estrogen and why it's so important in our body and what happens when we don't have it. So, estrogen, we have estrogen receptors all over our body, and it plays a role in our reproductive health and our cognitive health, also plays a role in our skeletal system and our cardiovascular systems. So, with the right amount of estrogen, as well as progesterone and testosterone in our body, it helps to regulate our menstrual cycles. It maintains our vaginal health. It has neuroprotective effects, so it helps with memory, cognition. It helps to regulate our mood. Estrogen is so important for our bone formation and resorption, so making sure that we maintain good, strong skeletal muscle, and it helps to maintain our bone density. It also helps to support fertility and pregnancy, reduces coronary event, and influences our lipid metabolism. So a lot, and these are just some of the roles, but every single organ system in our body has these estrogen receptors. And so it's really important that we have the right amount of estrogen. Now, during menopause, this is when a woman has permanent cessation of menstruation confirmed after 12 consecutive months without a period. So once you have not had a period for 12 months, you are menopausal. But there is a transition phase, perimenopause, which can start very early. So some women start to experience perimenopausal symptoms around the age of 35 to 37. So from 37 to 45, that is when the average woman is in perimenopause. And what starts to happen during this time is we start to feel some or have some irregular menstrual cycles. So they might be longer, shorter. If you're on a 28-day cycle, it may shorten to a 21-day cycle. And we start to experience some of the onset of menopausal symptoms. And during this time, we start to have fluctuating hormone levels. If you follow Dr. Haver, Mary Claire Haver, she talks about the the chaos that exists in our life because of our hormone levels being so all over the place, where before they were really in a nice rhythm. Women also start to, during this phase, experience changes in memory performance, vasomotor symptoms, and heart palpitations. And my aha moment when I knew that something was not right and I needed to seek treatment was when I went to the kitchen with my dirty coffee mug and I was going to put it in the dishwasher. And there was other dishes in the sink and I started putting the dirty dishes in the dishwasher and then I proceeded to empty all the dirty dishes and put them away. And then I stood there going, what did I just do? I just put away all the dirty dishes and I don't know where I put them. Like, I don't, to put them back into the dishwasher. And these were things that were happening quite a bit. And I knew it was affecting my work. It was affecting my personal life. It was affecting my relationship with my husband. And this is where I was like, things are not right. And these are all of the things that the women previously that came to me for help were complaining about. I had a lot of weight gain in the midsection. I started getting like this weird back fat. And I'm like, where is this fat coming from? And I'm a dietitian with a PhD. I know what to eat. So I was restricting calories, I was exercising more, and nothing was changing. And I was perimenopausal. So it really hit me around the age of 47 is when it really struck where it was affecting me on a greater level. And some of you may have experienced that. And if you want to share your experiences, go ahead and put it in the chat. What were some of the first signs that you possibly were feeling? Or symptoms that you're feeling that you're not sure um, are related to menopause. So around the age of 45 to 55 is when we are actually in those menopausal years. This is when most women start to go into menopause where they don't have a period for a year. Around the age of 51 is the average age. So no period for 1 year. We start to see a significant decline in estrogen and progesterone, and we start having more of the physiological changes that I spoke about earlier. And then postmenopausal is the time after not having a period for a year. Eventually, there will be some stabilization of symptoms, but there are increased risk factors for certain health conditions such as heart disease and diabetes, insulin resistance. Eventually, we will see a decrease in the intensity of menopausal symptoms, but those symptoms are very real, and they can be very debilitating for women. All right, Amy says, starting the weight gain for no reason, frustrating, excited to hear more. Yeah, the weight gain was really affecting me. And it's really a shift from fat mass to muscle mass. And I'm going to talk a little bit more about that. Here's something that's really eye-opening for me. There was recently a survey that was published in the Mayo Clinic proceedings. And what it revealed was that 6.8% of residents feel adequately prepared to manage menopause. Only 6.8%. Now, these are going to be our future doctors. 93.8% believe that menopause management training is important, but only 20% report receiving no menopausal lectures during residency. So they know it's important, but they're not getting the education during the residency. And this is not uncommon. They don't get any nutrition information either. Now, how does this affect us women going to ask for help with our doctors? Well, only 34.4% of doctors would not offer hormone therapy to women that have eligible symptomatic issues. So you have symptoms, you're going to the doctor, 34% would not offer hormone therapy, and 38.7% would correctly prescribe hormone therapy. So only 38% of doctors are comfortable with treating menopausal symptoms. So why did this happen? So I'm going to give you a very, very brief overview of the Women's Health Initiative, which was a really big study. And this study kind of stopped the use of hormone therapy. So back in the day, maybe your grandmother may have been on Premarin and estrogen. So women were using hormone therapy and they were doing really well with it. So in 1993, the Women's Health Initiative wanted to look at the health effects on women taking estrogen or estrogen and progestin, and how it affected their cardiovascular health, because we were starting to see cardiovascular protection from taking hormone therapy, but we needed more research. We never had a clinical randomized controlled trial, and so they did this study. So the women were put into two groups. If they had a uterus, they received estrogen and progestin. If they had a hysterectomy, they only received estrogen. Now, progestin protects the cervix from developing endometriosis, cancer. So we want to make sure that that was protected. So anytime you have the cervix, you have to take estrogen and progesterone together. So that's what they did. Two groups, and they wanted to compare how the two groups did. So the first findings were published in 2002. And I remember this, I was in school at the time, getting my degree as a dietitian, and the Women's Health Initiative study found that the women that were receiving estrogen and progestin had a higher risk of breast cancer. So before the study, women in general had a 3 out of 1,000 women were diagnosed with breast cancer. That was the statistics. When they looked at the women in the Women's Health Initiative study that were receiving the combination of estrogen and progestin, the risk increased to 4 out of 1,000 women. So if you look at something, this is a statistical analysis, it's called a relative risk. The relative risk increased by 25%. So what they found was that there was a higher risk by 25% of women developing breast cancer. So the doctors were like, put the brakes on. We cannot continue this arm of the study. And so they stopped. They did continue the study with women who were taking estrogen only, because at this point they saw there was a decreased risk of colon cancer. There was an improvement in bone density, so decreased osteoporosis. Now the media went crazy with the information and published it everywhere. And it was all over television that estrogen causes cancer, breast cancer. So women stopped taking their estrogen or their hormone, and doctors stopped prescribing it. And hundreds of thousands of women stopped being treated for perimenopause and menopausal symptoms. Now, the outcome of this was we have seen an increase of vasomotor symptoms. So 80% of women experience hot flashes and night sweats. We see
Hey,
rapid,
buddy.
hello? Did someone have a question? Okay. We see rapid bone loss, especially in the first 2 to 3 years post-menopause. So we're seeing higher rates of osteoporosis and fractures. We are seeing women being diagnosed with cardiovascular disease. One of the symptoms that I get a lot from women are heart palpitations, and they go to the doctor, they go to a cardiologist, they wear a heart monitor for 2 or 3 days, maybe even a week, and they still have heart palpitations, and nothing's wrong with them. It's menopause. We also see an increase in genital urinary symptoms. So we're seeing vaginal atrophy and dryness. We're seeing changes in the vaginal microbiota. We're seeing increase of urinary tract infections and something known as genital urinary syndrome. The risk of anxiety and depression is increased. So there is a 2 to 3 times higher risk of developing psychiatric disorders. We see higher levels of stress in women and increased susceptibility to depression and anxiety. We also see more issues with cognitive decline in women that are menopausal. So since 2002, there has been a higher incidence of women with cognitive decline. We have an increased susceptibility to Alzheimer's disease, difficulties with memory and finding words, and difficulties with attention and concentration. So here we are today. The top 5 complaints that women complain of are going to be weight gain and changes in body composition, brain fog and memory issues, anxiety and depression, sleep disruption, and hot flashes. Now, interestingly, going back to this study, when I told you they measured relative risk, so there was a 25% increase that women would get breast cancer. But when they looked at something called absolute risk, which is more valid, it's a more valid statistical analysis, and it looked at the actuality of women getting breast cancer, the absolute risk was 0.8% of women in the study developed breast cancer. So 25% versus less than 1% is a very big difference. And after all of the information was publicized by the media, the researchers came out and said, no, you're looking at relative risk. You're not looking at absolute risk. The risk is not significantly high for women that were receiving estrogen and progestin. Now, what they didn't look at in the study was what type of progesterone, which is one of our hormones. They were taking progestin, which came from horses. Um, that was part of the issue. The other part of the issue was women in the study were over 65, which they already had an increased risk of breast cancer anyway. So it was a older population. And we also saw that women in the estrogen only group actually had a reduction of breast cancer. But yet, the message that went out to the world was estrogen causes breast cancer. And so women stopped receiving care and treatment. Menopause treatment in general, as it relates to lifestyle choices such as exercise and nutrition, wasn't being discussed either. So women were not receiving any relief. And we have to understand that menopause is an inflammatory event. So estrogen is a protective hormone. It protects us. And when it's diminished, we lose that protection. And what happens is that we start to experience chronic systemic inflammation that affects our organ system and results in osteoporosis, coronary artery disease, insulin resistance, type 2 diabetes, neuroinflammation, which affects our cognitive performance, visceral fat, and sarcopenia. And sarcopenia is loss of muscle mass. Visceral fat is the fat that we're gaining around our abdomen. Thank you, perimenopause and menopause. So there's different things that we can do. So I'm not a doctor, so I can't prescribe estrogen or progesterone or testosterone, but hormone therapy is one option. It is very safe, and a lot of women are back on hormone therapy. There's also lifestyle factors, which I'm going to talk to you about today. Now, hormone therapy, I'm going to just talk very briefly about my experience. So at 47, I started taking estrogen and progesterone. Almost immediately, my symptoms started to go away. I was starting to sleep at night. My hip pain went away. I was starting to lose weight. Now, I also found out during this time I became insulin resistant, which is what is happening when we're gaining that weight around the abdomen and that back fat that we gain. That is a sign of insulin resistance. And this has to do with the decline of estrogen in our body. So I took estrogen and progesterone. I also changed my diet drastically. And I'm going to share that with you in a moment. Now, in November of last year, I had a total hysterectomy because I have a genetic mutation. I found out there's 8 of us in my family that carry this gene that we are diagnosed with a condition called Lynch syndrome, and it increases our risk of cervical and ovarian cancer by like 40%. So me and 3 of my other cousins have all had total hysterectomies. We're all similar in age. And so because I went into full menopause the moment I had the hysterectomy, um, the amount of the hormones changed, and my doctor did also add a little bit of testosterone. Oh, Robin, we have some to talk about. So Robin also has Lynch syndrome. And so I am taking this combination of hormone therapy. A lot of women are taking it, but there is still some women that are wary of taking it, and that's completely understandable. So one of the things I want to just briefly mention that we're learning about right now, and we're going to see more research come around this, is the timing hypothesis and the healthy cell hypothesis. So part of this information came out of the Women's Health Initiative, and some of it's still being studied, and the results go back and forth with different doctors. So the timing hypothesis says that when you start hormone therapy within 10 years of being in menopause, so let's say you start menopause at 50. So if you start hormone therapy within that 10 years from the time you're 50 to 60, you're going to have the most benefits on the body. So estrogen works better, as well as progesterone and testosterone, works better in cells that are healthy. When we get to past that 10-year point, as we age, the risk factors increase for us to develop other diseases. So if the cells are unhealthy, estrogen is not going to make them healthy. So when we are in this perimenopause and right at the start of menopause, that is the optimal timing for us to start hormone therapy. So I encourage you to talk with your doctors to make sure that that timing is right for you. I feel that because I started hormone therapy before I went into full menopause, even though I was experiencing symptoms, I didn't have as severe symptoms as some of my friends and family members that went through menopause that really struggled through it because they were scared to go on hormone therapy. So that's hormone therapy. So talk with your doctor about it. And I'm more than happy to talk to you more about my personal experience after this if you want to reach out to me. What I really want to focus on is dietary modification, strength training, stress management, and sleep hygiene, because these are things that can help play a role in reducing the symptoms that we feel from perimenopause and menopause. So the first thing is an anti-inflammatory diet, because remember, menopause is an inflammatory event. So the foods that decrease inflammation are going to be our fats. This is not the time where we want to be restrictive with calories. And as a registered dietitian, when women were struggling with weight, I would say reduce your caloric intake. Now I'm like, no, we need to make sure that we're eating a sufficient amount of good, healthy fats because we need those omega-3 fatty acids. It also helps us to continue to produce estrogen. So we do produce estrogen from our adrenal glands, which are 2 glands that sit on the top of the kidneys. And it helps us to produce hormones. So making sure we have a good, healthy fat from our diet, from like salmon and avocados and nuts and seeds and plant-based oils, this will help us to decrease inflammation. It'll help with the adrenal glands. And we get really dry during menopause, like our skin, our hair, our vagina, things dry out. The fats from the diet help to maintain it. The other thing is good quality protein. So what the research is showing right now is that we need good sources of protein. I think Kay, did you have a question, Kay? No, maybe not. Okay. So we need really good sources of protein. I would always recommend back in the day that we had like zero point 0.8 to 1 gram per kilogram of body weight. And that has all changed. And now they're saying, ladies, you need a lot of protein. Eggs, chicken, fish, turkey, beef, pork. We need to make sure we're getting good sources of protein because during this stage in our life, our body composition is shifting. And you may have all been experiencing this. So we go from having less muscle mass and it shifts to more fat mass. And that's why we're feeling softer and we're gaining weight around our abdomen and our backs, our legs, our arms, our faces, because there's a shift in body composition. And so by increasing protein intake, that can help reduce this shift. Now, carbohydrates become a little bit tricky because most of us become insulin resistant during this time. So, what I did, and I didn't love this time of my life, but I did it and it worked. I stopped eating any carbohydrates except for fruits and vegetables, but any breads, pastas, white potatoes, rice, my favorite sweets, I eliminated all of it for 3 months. And it wasn't fun. But let me tell you, I started seeing after that 3 month period, I really started to see changes in my body composition and my insulin resistance started to become more normal. So we really want to focus on vegetables and fiber-rich fruits. Fiber is so important because one of the other things that gets affected during this time is our gut microbiome. So we want to make sure we have good sources of fiber to feed that gut microbiome so we have good healthy bacteria because the bacteria in our gut also helps with our neuroinflammation. So we want to focus on healthy fats, good quality protein, and a fiber-rich diet. Here is my perfect menu for what to include with each of your meals. You want to try to have at least 6 to 9 ounces of protein with lunch and dinner with 2 cups of vegetables. And with fruits, I like to have a high protein diet that also focuses on, I'm sorry, did I say 2 cups of fruits? I meant 2 cups of vegetables. So let me go back. Lunch and dinner, 6 to 9 ounces of protein, 2 cups of vegetables. With breakfast, I like to have a high fiber, high protein breakfast that also incorporates berries. And then for snacks during the day, nuts and berries. And if you can do that for 3 months, you will, I promise, see a lot of changes in your body composition. And after this meeting, I'm going to send you the recording, but I'm also going to send you a little cheat sheet with all of this information. Now, we know that a lot of the things that we experience in menopause can be treated with nutrition intervention. So we can reduce musculoskeletal pain. That's what MSK is, musculoskeletal pain, if we have an anti-inflammatory diet. You're not going to alleviate all the pain, but it can help to reduce the inflammation and reduce pain if you're having joint pains. The higher fat in the diet can help with the hot flashes. A lot of women experience heartburn and GERD, which is gastroesophageal reflux disease. So by eliminating sweets and processed foods, you can decrease the heartburn. A lot of women also develop non-alcoholic fatty liver disease. So if your cholesterol and your triglycerides are suddenly high, even though you haven't changed your diet and you're still exercising, thank you, menopause. But the diet, having high fiber and the good sources of fat, can decrease the risk of non-alcoholic fatty liver disease. We also, by having a well-balanced diet, can decrease the risk of osteoporosis. And a lot of women, their autoimmune disorders are triggered by menopause. So again, anti-inflammatory diet will decrease some of the symptoms we can feel from autoimmune disease. I'm going to talk to you about visceral fat, but a high fiber diet can help with gut health. A high protein diet helps with sarcopenia, which is loss of muscle mass. So by having higher protein, we can maintain our muscle mass. We also see improvements with brain fog and then issues with high cholesterol. Visceral fat is the fat that accumulates in our stomach. And every woman feels that shift in body fat in their stomach during this time. Now, visceral fat is metabolically active. It's not the good fat that we want in our body. If you gain weight on your hips and your butt, that's called It's subcutaneous. It's not going to affect your health. However, if you are gaining weight around your abdomen, that is the visceral fat. So we call it apple shape versus pear shape. So if you're apple shape, you're gaining weight in the stomach. If you're pear shape, you're gaining weight in the hips and thighs. So visceral fat is metabolically active, which means it releases inflammatory cytokines and creates an inflammatory response in the body, and it increases our risk of high cholesterol. It causes insulin resistance. It is linked to chronic inflammation. It's the risk factor for type 2 diabetes. It causes or it plays a role in cardiovascular disease, and it can affect cognitive impairment. So if you're carrying fat around the midsection, you really want to follow that diet protocol that I told you about because it will help to eliminate and decrease the amount of visceral fat on your body. Now, stress also plays a role in visceral fat. And what we see is more women have higher levels of stress during this time in their life because they're not sleeping, they're confused because of the cognitive issues, the brain fog, they're not feeling good. All of these things lead to high levels of stress. When we are stressed, we release cortisol, and cortisol also contributes to us gaining more of that visceral fat. Also, because we're not sleeping, sleeping has been linked to increases in visceral fat as well. So we really need to follow this anti-inflammatory diet. We need to make sure we're getting a good amount of protein, like 90 to 110 grams of protein per day. And that was everything against what I learned as a dietitian. For me, it was like women should have about 65 to 70 grams of protein per day. And now we're seeing during this time in our lives, we don't metabolize and we don't repair our muscle mass as efficiently as we used to. So we need to eat more protein to get the same benefits. So at least 90 grams of protein per day, up to 110 grams. And we need to exercise. I'm going to talk to you about exercise because we can't be fragile females. We have to lift heavy weights during this time of our life. Now, intermittent fasting goes back and forth. Some studies say it helps, some studies say it doesn't. I recently read a study that shows that when women get up in the morning and eat protein, you're going to have better protein synthesis during the day. So we need protein for all kinds of things in our bodies, like building muscle mass, but also for our cells and our tissues and making hormones and making enzymes. Protein plays a role in everything that happens in our body. So we need to make sure we're getting enough of it. And it's beneficial if we get up in the morning and eat, specifically a high protein diet. So if we're intermittent fasting and not eating till noon, we're missing out on that opportunity to have that good nutrition and set us up for the day. So if you do want to try intermittent fasting, my recommendation is stop eating after 7 p.m. and then eat at 7 a.m. So you have 12 hours of fasting while you sleep because we don't want to be hangry during the day. And you're sleeping anyways, and this is the time for rest and recovery and healing. So if intermittent fasting is something that you want to do, it doesn't have to be in the morning. Let it start in the evening and while you are sleeping. There's no reason why we need to struggle through intermittent fasting. Now, the next thing is strength training. We need to lift heavy. We need to lift weights. Back in the day, again, it was restricting calories and cardiovascular exercise. Cardio is still important, but what we are seeing in the research now is strength training is so important to maintain our muscle mass because we are at risk of osteoporosis and we are at risk of sarcopenia the moment you start menopause. So if you are premenopausal and perimenopause, start lifting weights. And we need to lift heavy. So you want to work with a strength coach that knows what they're doing, that can help you to safely start to implement some sort of strength training activity. You don't have to go to a gym. You can do it from your home with kettlebells and hand weights. Jumping rope is fantastic because we're building bone density when we are jumping. We can use bands. There are a lot of different things that we can do, but we need to start lifting heavy weights. Ideally, the goal would be to squat our body weight. Stress management. We are all stressed out. Good or bad, we all have stress. And so some things that we need to look at are, do we need to look at therapy at this time in our lives? Most of us are empty nesters during this time in our life. And so you have a lot of changes. It was interesting, if you watch the Oprah's special on menopause, there was a staggering statistic, like 70% of women attribute their divorce to the time of perimenopause and menopause. So I think therapy for a lot of women can be beneficial to kind of understand what's happening in this time of your life, but also getting through it in a healthy way. We need to exercise, get out and get in nature, get some fresh sunlight, get some fresh air, dig in the garden, do something, but be outside and kind of allow nature to help with stress reduction. Find methods for relaxation. Make sure you find time for yourself. Find a hobby that you love. Let me move this over here. Music therapy can be really good, and yoga has been beneficial not only for stress reduction, but yoga is also really great for joint pain. So if you are experiencing joint pains, try a yoga class. The other thing we really need to focus on is going to bed. We need to optimize our sleep environment so that we sleep better. So if you are experiencing the hot flashes, you want to drop the temperature of your room 60 to 67 degrees. Set that thermostat. For anyone in your house not going through menopause, give them extra blankets, but create a cold environment. You will sleep better if you're not sweating. We also want to remove bright lights, any disruptive noise, also eliminate any exposure to those blue light emitting devices. So if you keep your phone in your room, cover it up. If there's any laptops or computers, get rid of it. Those lights affect our deep sleep, that REM sleep. So you want to make sure that you are getting rid of that so it doesn't affect your sleep. And then wear lightweight clothing. We also need to set a consistent sleep schedule. I don't know about you, but a lot of people do not have a consistent sleep schedule. So our bodies want consistency and our bodies love to be on a schedule. So you want to go to bed and wake up at the same time every single day, even on the weekends. Think of children. Children have a bedtime, and the parents put them to bed at 7 or 8 o'clock every single night because they know that sleep is good for the kids. But at some point, when we become adults, we forget how important sleep is. Go to bed. Set a time where you go to bed and you sleep. Now, you can create a pre-bed routine to quiet the mind. I suggest turning off the television, read a book, a motivational book. Right now, I'm reading The Let Them Theory by Mel Robbins. Take a warm shower, maybe do some kind of relaxation techniques, like listening to a podcast that has, or that calm podcast, for example, that will quiet the mind. And then exercise. So if you're exercising and doing strength training activities, this also benefits sleep. So studies have been showing for decades that people who exercise on a regular basis have improved sleep quality. So we're going to make sure that we're eating an anti-inflammatory diet. We have some sort of movement every day that includes strength training, and we create a nighttime sleep schedule. The last thing I want to tell you about is supplements. And I'm not one to push supplements, but during this time in our life, we need to be very strategic with the supplementation that we are using. And these supplements are important for our bone health, and can help with brain fog and sleep. So calcium and vitamin D for bone health to prevent osteoporosis. Women need at least 1,200 milligrams per day. What I recommend when you are taking calcium supplements, take it with your meals, take like 500 to 600 milligrams in the morning and then in the evening with dinner. If you take it all at once, you're only going to absorb about 25% of it. So it's better to split your doses and take one in the morning, one in the evening. If you can find a supplement that has calcium and vitamin D and vitamin K all together, that is fantastic, because it's less pills that you have to take. So try to find that combination. Vitamin D is very important because it functions much like a hormone in our body, and most of us are deficient anyways. Vitamin D helps us to absorb calcium. So we want to prevent osteoporosis. Omega-3 fatty acids, about 2 grams per day. Creatine has been on the market for a long time and was basically used for enhancing athletic performance. So it's really good for you if you're building muscle mass, but the recent studies have shown that creatine is an excellent supplement to improve cognitive performance. So 5 grams per day has been game changer for me. I put it in my coffee or my smoothie in the morning. And I have noticed that it's helped me with multitasking, getting through my day, because that brain fog was killing me in the afternoons. So that has significantly helped to keep me on track and focused. Berberine is really great for metabolic health, so about 500 milligrams a day. It will help reduce cholesterol levels. So if your cholesterols are creeping up, high fiber diet, exercise, and berberine. Um, but it also helps with insulin resistance. So it's really great for supporting our metabolism. So for metabolic support. And then magnesium L-threonate at night helps with sleep. So I like to take a brand called Garden of Life. They're magnesium gummies. It's kind of like a little sweet treat at night, but I sleep so much better when I take magnesium. So the best practices, these are going to be the key takeaways that you're going to take with you. You want to aim for at least, so 1.2 to 1.6 grams per kilogram per day equates to about 90 to 110 grams of protein per day for women. You also want to focus on at least 30 grams of fiber per day. One of the best ways to ensure you're getting enough fiber is to have 30 different plant foods throughout the week. So that might sound like a lot, but let's think about it. If we start with lunch and you're having a salad, so your salad has mixed greens and some tomatoes, avocados, you're going to put some pumpkin seeds in there, artichokes, you've got 5 things in your salad. And then for dinner, let's say you're having salmon with some lentils and roasted red peppers. We're at 7 foods and we're only on the second meal of the first day. So we can very easily get 30 plant-based foods in our diet per week. And that's a good way to stay on track with 30 grams per day. If you're eating 2 cups of vegetables for lunch and dinner, you're good. Movement every single day. So walking, cycling, strength training. If walking is greatly underrated, and I'm telling women if they don't really want to go to the gym and lift heavy, get a weighted vest about 8 pounds, and then you can slowly increase it up to 12 pounds, but walk with a weighted vest. Your body weight will help, and walking is fantastic for you. But get movement into your body every day and try to increase the strength training. Here are the supplement recommendations: omega-3s, vitamin D with vitamin K, magnesium, and calcium. We want to focus on stress reduction and sleep hygiene, and also limit alcohol. Every single menopausal woman says to me, please don't take my wine away from me. Wine during perimenopause, we metabolize alcohol very differently. So if you're not sleeping, it could be if you're having a glass of wine at night, the wine is really affecting your sleep as well. So try omitting alcohol and see if that helps improve your sleep. What I was having a lot of problems with alcohol, and then when I started hormone therapy, I saw improvements with being able to metabolize alcohol. And then we want to limit saturated fat because of the risk of heart disease, and watch having too much sodium. Okay, I'm going to leave some time for questions. I do want to, before I open up questions to you, everything that I told you about today are things that you can take home and you can start right now. You can start implementing it. If you go to my website, I have some free resources. I have a mindful eating guide. I also have a sleep hygiene guide that you can download right away. If you feel that you need a little bit more support, I want to tell you about a program that I started called About Time to Live Well. And I did this because a lot of women that come to me for menopausal support and how do I lose weight, and they come for 1 to 2 sessions and they do pretty well, but then they're only with me for 1 or 2 sessions. And what I've noticed is that women who are within a community do better. So I started a community for individuals that need to not only have menopausal support, but just that are trying to lose weight or just to be healthier in this stage of our lives. And so it's called About Time to Live Well. And what I offer in the program is once a month, I do a coaching call. So it would be something very similar to this about menopause, heart health, high cholesterol, any kind of topic related to nutrition and lifestyle. I also teach women how to develop their own nutrition plan because I can give you a nutrition plan, but wouldn't it be better if you know exactly what to eat and why you should include certain foods and why you should omit certain foods? So I provide you with the education so that you can create the perfect personalized nutrition plan for you and you can adjust it as you move through different stages of your life. I also provide weekly Q&A sessions. So it's a live 1 hour session with me where you can come and ask me anything you want throughout an entire year. I also have a private community, so it's very much like a social media page, but it's a private community just for people that are signed up for the About Time to Live Well program. And I also include different workout ideas just to keep you motivated. There are so many great trainers on Instagram and Facebook. So I share workouts that I do every single month. So for the cost of so for me to do an initial nutrition assessment and do a consultation, it's about $350. And then with the follow-up, you'll spend $469. So what I've done is I've created this community where I can educate a lot of women at one time, as well as men, where you get access to me for an entire year for the cost of an initial consultation and one follow-up. If you want to try it out and see if this is something that would work for you, I do have a monthly plan where it's $49 a month. And you can get all the information for the personalized nutrition plan, the weekly meal plans, monthly coaching calls, and the live Q&A sessions. If you sign up for the annual plan, you get a 20% discount on the monthly fee, but you also will get VIP access to any webinars like this that I'm doing. You'll also get discounts on any nutrition consultations if you decide that you need additional one-on-one consultations, as well as supplements with Thorne and pure encapsulations, as well as Gaia herbs. So I offer my discount that I get, I give and pass on to you. So you get about 15 to 25% off of all of these supplements. Here are some testimonials that I've received from people saying that the combination of recipes and meal plans and the grocery lists made it easy to stay on track. The workout plans are simple to follow and fit perfectly into my busy schedule. So we're all going through this together. And so I want it to be, this community is a way that I can share my experiences as well as let the other individuals that are signed up for About Time to Live Well to share their experiences and support one another. The live Q&A sessions make it feel personal, and the VIP access to events and new resources keeps things exciting. So if you sign up today, you'll get immediate access to About Time to Live Well. I'm also going to give you a copy of my book, a digital copy of my book. So I wrote a book last year called Limitless Health, and basically it is 21 different strategies, lifestyle strategies that you can implement right away. Instead of chapters, I did day 1, day 2, up to day 21. And every day, if you read a chapter, you can implement a new lifestyle strategy that will help you to achieve your health and wellness goals. So I'll send you a digital copy of that. And then you'll have access to all of the pre-recordings that we've done if you sign up today. So I'm going to share with you a QR code. I'm going to leave this QR code up. If you scan it, and I'll also put links in the chat. If you scan it, you'll get all of my information. So it's a business card. You'll see the thing to sign up for About Time to Live Well. You'll also get access to my my website where you can download some of those free resources. And I wanted to show you, well, I won't show you just yet. I'm going to open up for questions, and then I'll show you actually what the community looks like and what About Time to Live Well looks like. So with that being said, I'm going to stop talking and answer questions. Okay, so you can unmute yourself or type in the chat. So Amy says, is hormone therapy covered by insurance? Yes. So my hormone therapy, I pay $10 a month, and my insurance does a 90-day supply. So I pay $10 for my estrogen and progesterone. The testosterone is not FDA approved for women, but I pay $45 for a bottle that'll last about 6 months. So the doctor has to prescribe it off label, which is interesting because in the UK and Australia, testosterone is FDA or is approved for women to be used during this time, but it's not here in the US, but you can still get it. Any other questions? Okay. I'm going to stop sharing for just a moment, and I'm going to show you what the community looks like so that you have an idea. And if you have questions, and again, I'm going to send out an email right after this with all of this information and the recording. So if you do have questions, you can let me know. Okay, sometimes it's not as easy to share right away. Here we go. Okay, so this is our community. This is the About Time to Live Well community. I actually have two communities in here, but it's very much like a social media page where I have all of our meetups here. So you can just click right here, like our next live Q&A is tomorrow. So you can click right here and it brings you into a live platform where we have basically a lunch and learn. There's different challenges that I do. Whoops, you're not seeing anything. Let me try that again. Okay, can you see it now? I think it just said they can now see. So hopefully, Kay, you can see it. Let me know if you cannot, and I'll try it one more time. But this is our community. There's different challenges. There's different feeds where we chat to each other. And then, and it's a private community, so it's just for other people who are signed up for it. And then this is the actual About Time to Live Well subscription page where I have a lot of different information. So I'm going to scroll down. We have our schedule of our coaching calls. Here is the information on how to develop your own personal nutrition plan. So it's kind of set up like a class, and you go through this information. And then when you come to the live Q&As, you can ask me any questions on how to implement, as well as it's kind of a great way to hold for accountability. So if I like, okay, this week, this is our meal plan that we're going to follow for the week. We talk about it, we implement it, we come back the next way, we talk, or the next week to talk about any challenges that we had or any questions, any kind of reassessing or modifying our goals. And so we do it as a community so that we can support one another and we can continue it for an entire year rather than just having one or two sessions and then having to go home and figure out how do I maintain this. These are the meal plans that I have that I post every week. And then, so for example, these are the on-demand videos. These are our videos that we've already have. I include recipes. So anytime I find a fun recipe, I include it here. Here is links to my podcast and then links to different exercises that I have been doing for the week. So for example, here was March, and I include links right to the Instagram of the people that I'm following. And it's just really great activities that you can do at home. I do them in my gym, but it's just a way that we can support each other. So that is the community, and that is About Time to Live Well. So we're starting to get to the end of our hour. So I wanted to thank you so much for joining me today. I hope that you found this helpful and that it's information that you can take away. If you choose not to sign up for anything, there's no pressure at all. I will always be sending you emails every week or a couple times a month just with new information to keep you motivated and excited. But I'm always here for you if you ever have any questions. Any last minute questions or concerns before we end this? You're very welcome, Robin. And I hope everything is well with you. And I know you said you had Lynch syndrome, so I hope your experience has been beneficial. I think the positive thing with Lynch syndrome is now that I'm on full hormones and I've changed the way I eat and exercise and do things, I'm like, I feel actually much better than I have in the past. I would have given my ovaries away a long time ago if I knew I would feel this good. So it's been a positive experience for me, and I hope you too. And I hope for every woman going through menopause, they go through it with a positive experience. Thank you so much, everybody. I will send you the replay. Have a great afternoon, and thank you so much for joining me.